Hello, everyone. It's Tuesday, May 26th. I hope and pray that everybody had a wonderful Memorial Day weekend. I've got to announce 2 more deaths that we had in West Virginia, and I'm sure these families have had a tough Memorial Day weekend. And so we lost a 54-year-old male from Lewis County and a 74-year-old male from Mineral County. And again, I go over and over the same thing. The number of deaths we have in West Virginia, considering where we are, the vulnerability of our citizens and the chronic illnesses of our citizens, it is unbelievable how good it really is. But there's nothing good when you think about losing 73 West Virginians. And so please keep these people in your thoughts, your prayers. They've all got a name. They're not a statistic. They're absolutely great people that have done so much for our state. You know, losing somebody 74 is not good, because they should have lots and lots of life left in front of them. But losing somebody 54 is really bad too. And so please, again, I'm sure these were fathers or grandfathers and maybe brothers, and you know, I just hate it. I just hate it. That's all there is to it. And so, but we just got to do what West Virginians have to do, and that's be strong and keep moving north and keep moving. And so I can tell you, as far as our comeback, you know, and our reopening, that seems to be going very well. You know, we're trying to do that while monitoring, as I've said over and over, with our health experts and our medical communities and everybody really watching like a hawk. You know, we're trying to monitor everything to keep you as safe as you possibly can be. Now, with that being said, we have to reopen. You know, if we all just sat at home, you know, the problem of other illnesses or considerable more death, maybe from everything from drug overdoses to suicide or whatever it may be, would be rampant. And on top of that, if we all just stayed at home as a nation, our nation would implode. We would drift into a depression, and absolutely it would be catastrophic beyond belief. So we got to live with this disease, and we got to somehow be smart. Now, the CDC has now told us that as far as droplets on a, you know, elevator button or a doorknob or whatever like that, that level of exposure has been significantly decreased as far as that being a way for you to get this disease. The disease is really easy because it's transmitted human to human. And so when you go out in public and everything, and you're going out into a building or wherever it may be, wear a mask. Just take care of yourself, and just continue to be really smart West Virginians, as I know you've been. Our reopening in week 5 begins today. Week 6 will begin next Monday, June the 1st. And all of the guidelines and everything that we have up here, you'll see that the pools and the bowling alleys and those kind of things are going to open on May the 30th. I really believe, you know, that if you'll look at our numbers, we were all apprehensive. Naturally, we won't see the impact of the Memorial Day weekend for a few days, but, you know, we are seeing, you know, that excuse me, that since we began reopening, we should have seen more and more numbers move in a really negative way. We're not really seeing that absolutely in a big way, but we're watching, and we're watching all the time. We had our first cases break out in our correctional facilities, and at Huttonsville, we were trying to limit the testing to a certain block in which prisoners were intermingling with one another and everything. We tested that whole block. You know, I told our people on Friday, I said, no, that's not good enough. Test everybody in the whole facility. You know, there was approximately 1,029 inmates there, plus, you know, there's a significant amount of staff. We have now tested everyone in the facility. We've confirmed 39 positive inmates. We've not confirmed any additional staff that was positive. Commissioner Betsy Jivinen is going to give you a report on that in a few minutes, but we do expect, as these 1,000, tests come back, these 1,000+ tests come back, that number is going to rise. We're on it, and our people are staying right on top of it, and we again ran to the fire, and I commend them for doing so. I had to make the decision to go ahead and test everyone, but it was the right thing to do. And so I think we're ahead of the curve and on top of this, and we're going to try to stay on top of it, because we've all known from day one, we've heard all across the news day after day after day of all the situations at the prisons and all the problems that the other states have had all across our nation. So we're on it, and we're trying to take care of these people just as we'd take care of ourselves, because they deserve that. And so that's what we're trying to do. I remind everybody that our free testing, and we encourage our minorities to come out, and our free testing now is going to start again tomorrow in Fayette County, on Friday and Saturday, back in Berkeley, Jefferson, Kanawha, Mineral, and Morgan counties. And so, like I said before, it's optional testing, won't cost you a nickel. Come in and get tested and everything, and it only helps us to broaden our testing, and it will surely help you. Maybe it will, displace some anxiety and everything, and hope and pray that everyone that gets tested is a negative. But if somebody does get tested and they're a positive, that really, really helps us to be able to minimize their exposure to others and really help in that. Our cities and counties, all the stuff is up. It's been up. We want to encourage you to continue to apply. We absolutely need you to apply, and for the dollars that we are able to get you at that point in time, we get those dollars, and we'll get those dollars out as expediently as we possibly can. I remind all the cities and the counties, just because you apply does not mean you can't reapply. And absolutely, as they continue to lessen the stringency of the guidelines, the more and more and more you will be able to apply and backfill. And absolutely, without any doubt in my mind at least, and I'm not the sole judge of this and everything, but I believe those guidelines will be relaxed to where it will be very, very beneficial to our counties and cities. So you need to get in motion and start applying now, and so you'll have it kind of down pat on what you're supposed to do, and our people can help you and everything to where you can benefit from this, and you very much should, because I know that all of you are hurting, as is the state, and all of us as individuals. So we want to take advantage of this as much as we possibly can. It puts more money into the economy, and it makes our comeback in West Virginia and our comeback in our nation even faster. I want to remind you again about our census. You've got to be counted. Please be counted. Let me tell you this, that a lady told me the other night, and I think it's a marvelous idea. And I haven't brought it up yet to our people and everything, but I'm going to just as soon as we get through here today. But if we could develop through West Virginians, to where you would basically adopt a neighborhood or adopt a street, and you would be like the team captain and everything, and you would take on yourself to call everyone on your street and ask them if they've been counted and everything, and encourage them to be able to get out or to go on the website and just do exactly that. It would be really beneficial if we could just have enough West Virginians to step up, whether in a community or whether on a street or whether it may be, and adopt that community or adopt that street. And I don't mean a community of 3,000 people, but I mean a community that would be 6 homes in your area and everything. If you just take the time to call everyone and say, please remind, the governor really is pushing us to make sure that we all get counted, and maybe that's a way that we could more efficiently do this, and West Virginians could take a whole lot more ownership in being able to pull this off and everything, because right now we're behind and we really need to get that done. I'm happy to say that our parks, we offered a 30% discount to anyone in state. We're going to continue to do that. That discount is from June 1st to August 31st, for people to get out and enjoy our parks and everything. And, the pricing was already great, but now the pricing is unbelievable. So go to our parks, but the good part about it is we got a 58% increase in our state park reservations this month compared to last year in the month of May. So people are using and taking advantage of our parks, and that's really, really great, because we've done a lot of remodeling and everything. And what place could be better right now than to go to our parks and everything? The rhododendron are starting in bloom. Now, the wilder rhododendron won't bloom until later, but there's lots and lots and lots of good stuff going on. We've had so much rain that it's made our rivers and streams high and everything. But in a lot of ways, as late as it is in May, if you're a trout fisherman and everything, and you enjoy that fishing and everything, the stream water ought to be terrific. And so go enjoy some trout fishing and go to our state parks. You'll find them unbelievable. Okay, last thing I've got is just this: is I always report to you on real quickly on our graphs. If we could put up our recovered cases to active cases, and well, they're all up, so you can see that our recovered and active, are still trending and moving along about the same lines that they've moved. They bumped up there. The top line we want to get wider. The bottom line we want to go down. But the top line bumped up. That's really good. The bottom line is just almost staying about the same, and that's the active cases, and the top line is the recovered cases. But we want the active cases to drop off. We did have a bump. We had a real bump, from the standpoint primarily of the Huttonsville prison. If you look right down below, you'll see in the next line, you'll see the daily percent of positives. And you can see right there, where they put that little block. I don't know what they did with that, but if you'll take the little block back off, okay, you'll see right there the little bump up. And those days and everything, that's an awful lot driven by the prison stuff. And yesterday we were at 2.29, and remember now, there's been some days we've been in less than 0.5%, and that's 2.29%, and so that in itself drives our cumulative number down below. You can see it's just eked back up a little bit and everything, and now it's at 2.05, still fantastic and everything, but nevertheless it has crawled back up just a little bit. And we're hoping that that'll turn the other way and start drifting back down again, from the standpoint of what's going on with the prison, the Huttonsville prison. But now, last thing I would report to you is just this. In West Virginia, you've seen it over and over and over on TV, but you've seen lots of places in lots of states where everybody's crowded together. For crying out loud, you know, they're having a pool party and they've got 1,000 people that are all around the pool and all, you know, just rubbing arms and touching each other, you know, and right up against one another. And so please, West Virginia, come on now. Please just try as hard as you can to stay socially distanced, and absolutely some way, somehow, you know, we're going to get through this, and we're going to get through this without more and more catastrophes. And remember, please remember that as you go out, try to think really hard, and I encourage you in every way to wear a mask, and I absolutely want you to know just this. You know, I used to say this a long time ago, but a long time ago we were killing 50,000 people a year on the highways. And now that's diminished a little bit. You know, I think the number is 36 or 38 or something like that. But nevertheless, I say over and over, can you really probably think of one of those people, one of them, that left their house that day and said, you know, today I'm going to probably be in a really bad automobile accident and I could end up dead. Well, to be perfectly honest, it's the same thing with all of us. None of us think we're going to get this. And really and truly, we all, as time goes on, we get a little more and a little more braver, you know, and as we get more bravery about what we're doing, then it can really backfire. So just imagine this, you know, just remember those great West Virginians we've already lost, how dangerous this disease is to our elderly, and absolutely just come on, West Virginia, just stay the course, and we're getting through this, and we're doing the right thing, we're pushing the right buttons, and I think you're making the whole world proud. Just continue to do so. Thank you.
All right, thank you, Governor. Let's first go to Betsy Jividen, the Commissioner of the West Virginia Division of Corrections and Rehabilitation.
Thank you. As the Governor informed you all, thanks to his quick action and quick response on Friday after we completed some of the testing, we were able on Monday to test 1,029 inmates, which was the remainder of the inmate population at Huttonsville. Those tests have been sent to CMAC, WVU, and the state lab. As of this morning, we had 40 tests back with 12 positive, which brings the total number to 39. The initial word is that we will be getting some more results in from the lab. They may be coming in now. Anyone who wants the update can look at the corrections tab on the DHHR COVID-19 website. We will put those numbers up this afternoon if we get additional reports processed. We're hoping that we will have the remaining tests back within the next several days, and we will plan our policy and our response accordingly. We've been working in close cooperation and coordination, of course, with the governor's office, with the Bureau for Public Health, with DHHR, local health departments, and the National Guard. And we are doing our best as we enter this phase 2, where we do now have positives in our facilities, to be proactive and to protect the health of both our inmate population and, of course, our staff who is on the front line every day facing these challenges and difficulties in their personal lives and professional lives. So again, I'd like to thank the governor for stepping in and helping us get the testing done yesterday, finish the whole population, and we're waiting to see what comes back. We have some contact tracing that has already begun and is continuing today, so we're hoping that will help us in future preventative and reduction efforts as well.
All right, thank you, Commissioner. Next, let's go to Major General Hoyer with the West Virginia National Guard.
Good morning. Some key areas that we'll be working this week include cyber hygiene support to agencies involved in the COVID-19 response. As many of you may know, There have been some threats across the country related to cyber intrusions. So the National Guard will be supporting agencies across state government in regard to that. We will be supporting the Division of Corrections where needed in response for both additional testing as well as sanitization and other subject matter expertise support going forward. Continue to work on PPE development, and that is in conjunction with a variety of organizations to include prison industries to be able to develop our own PPE, as well as developing test kits for ongoing testing support. We'll be preparing to support the testing lanes that the governor laid out as a part of the overall biopsy effort that the governor's initiated for us from a statewide perspective. And we will continue to work in other areas going forward related to support to other agencies in response to the event. Thank you.
Thank you, General. Next, let's go to Dr. Clay Marsh, our coronavirus czar.
Good morning. It's great to be with everybody this morning on a beautiful day. As the governor said, that we are very closely monitoring the activities and the testing and the R0 values so that we can continue to try to, have a picture, stay ahead a little bit of what may be happening in West Virginia. Our R0 level that we continue to watch is hovered somewhere between 0.88 and 0.94. It was 0.91 yesterday. It's not out today. And again, we are working to move that assessment piece to the county level. As the governor said, that we see on television and know from other states that cases are going up in about 10 states in the country. Montgomery, Alabama had no ICU beds or one ICU bed in the middle of the week last week. So we have to be diligent as we have been and not become complacent. There's been some question about the utility of masks and the data for that. And I think that it's fair to say that if you're vigorously coughing, then masks may not have the same protective effect. And we certainly recommend people still to cover your coughs, cover your sneezes with the crook of your elbow and with your shoulder. But we know that during normal talking or loud talking or singing, that we can aerosolize droplets as well. And masks do seem to have a benefit to reduce that aerosolization during those types of activities. And as we said before, mask wearing cultures in general have seen fewer deaths than cultures without masks. That's looking at Japan as an example, with less than 1,000 deaths in a country of 126 million is very powerful. But I would just say to people that masks alone are not a panacea, just like there's nothing that is. And it's really important that you continue to take care of yourselves. And that, again, takes care of other vulnerable people in our state. Remember, we have the most vulnerable state from a healthcare perspective. And so by continuing to socially distance, wearing face covers when you're out in public, and particularly when you can't distance physically 6 feet away from each other, or you're indoors and around other people, it really does send to me the right message that we're trying to protect ourselves and trying to protect each other, which helps us protect the state. And as we talked about before, we still, as a country, have not gotten away from the COVID pandemic. We're about to exceed 100,000 deaths in our country, and we have over 1.5 million cases. So it's really important that as we get back out and enjoy the beautiful summer, spring, and enjoy each other, that we continue to protect ourselves and protect West Virginia. And we know that by doing this together, staying together, doing this as a powerful, strong West Virginia state, that we will do it the best. So West Virginia, we succeed or we fail together. And I have great faith in you and our state. So thank you very much.
Thank you, Dr. Marsh. Now to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good morning. We now have the results of our first round of the high-density testing, African American Testing Initiative, and community-based testing. I wanted to share some of those with you. This was testing in the 4 counties of Berkeley, Jefferson, Raleigh, and Mercer. And through those 4 counties, we reached 2,385 individuals. Folks did a nice job of reaching out to the African American community with this, with between 18% and 41% of those coming to sites being African American. That compares to the population in those counties of being between 6 and 8% of their population. In terms of positivity, we certainly saw more positivity appear, more individuals who were positive in the Eastern Panhandle, the Berkeley and Jefferson communities, rather than more than the Raleigh and Mercer communities. In Berkeley and Jefferson, there were 30 positives together, 15 in each county. In Raleigh and Mercer, there was a total of 1 positive between the 2. So our percent positivity there ranged from about 1.7% positive in Berkeley, 2% positive in Jefferson, 0.3% positive in Raleigh, and 0% positive in Mercer. I want to say thank you to the local health departments and the community partners who worked really hard in the National Guard, who collectively really worked to do these testing sites. We continue to refine that process as we move to other areas of the state and come back to visit some of these as well. I also want to really highlight the role and say thank you to the local health departments and then also the support of the Bureau of Public Health staff in following up with individuals who are identified through this testing and making sure that they were linked into all the necessary support and contact tracing and case investigation. So thank you to the lots of work that has happened subsequently to that and continues to happen in follow-up to these events at the local level. Thanks.
Hello, everyone. I talk about this weekly. I want to make sure everyone is aware that while we focus on this pandemic, which is truly taking significant time of everyone in DHHR in one form or another, we're not neglecting our frontline efforts for the state's opioid epidemic. We continue to advocate and support vital recovery programs that are needed now more than ever. Feelings of isolation, disconnection, and anxiety are concerns of those who have recently completed a recovery program or who are about to begin a recovery program. Please remember there are resources to help. Visit the behavioral health page on our coronavirus.wv.gov to learn more. Again, these are difficult times. We are here to help. Please don't hesitate to contact us. Thank you.
Thank you both. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron from WSAZ. Obviously, this weekend was great for small businesses with so many different places open. Not as great, though, because, of course, occupancy isn't what it could be if we didn't have a pandemic. What's the state doing, maybe through the Commerce Department or some sort of task force, to help these small restaurants, locally owned restaurants, and other small businesses navigate what's to come in the months ahead? And right now, it's obviously a very difficult time for so many of them. Thanks.
Okay, Amanda, it was difficult. It was difficult to hear the question, but if the question primarily was, what is the state and/or Commerce Department doing to help small businesses, especially restaurants or businesses that were struggling, from the standpoint of, the capacity rules or whatever it may be, how are we going forward to be able to try to help them? And if that's the question, is that pretty much the question, Amanda?
Yes, sir. Thanks.
Okay. Well, let me kind of elaborate on it just a second. First of all, we're monitoring the rules, and I tell all of our small businesses to stay on top of this as best you possibly can. I really believe there's going to be another stimulus package that's going to come out. I believe the rules are going to be continually modified from the federal government side. I believe as we go further that more and more relaxing of that capacity or whatever will happen, provided that we don't slip back and end up with a big time problem. Now, with that, I totally get the economics. I'm there. I completely understand it. And at the end of the day, I know that we can't put life above economics, but if we don't watch out, when we don't have the economics, we are exposing life. And so with all that being said, we're on it, and I would promise you that that our Commerce Department, our governor's office, your governor, is watching this in every way nonstop. Now, I'll give you an update just real quick on just one other thing. The PPP, or some people call it triple Ps and all that kind of stuff, but that program is for small businesses to apply. And then you have a window. Today it's 8 weeks, but I think that's going to be elongated and everything. You have a window that you got, that loan is forgivable. There are still significant dollars that are sitting out there that you can still make application for. So if you have not done that and you're a small business, for crying out loud, please go try to do that. And what you've got to do, is we'll try to help you. It is basically a loan, and they're loaning the money with the idea in mind that it is going to be 100% forgivable. So if you're a small business and you have not applied, you're really missing the boat. You've got to try to apply. If you're a small business and you think that you're not eligible, for crying out loud, run and try every ability that you can to question the people either at SBA or the banking community, or call us or whatever, and we'll try to help. Now, with that being said, so it's kind of several points here. That's the first thing. The second thing right behind it is, remember, there's another stimulus package coming. Right behind that, I really believe the guidelines are going to be relaxed on our businesses from the standpoint of the federal government, saying things like we're going to elongate the 8 weeks to 16 weeks or 12 weeks or something like that, to where you can backfill and be able to get that loan totally forgiven. The other thing is right behind that is, if our numbers continue to be better and better and better, naturally on the in dining, we will relax that 50% rule and maybe even be able to remove it. And as we go forward, just all we can do is just do the things we've been doing. Watch our numbers, continue to be totally transparent, and try to help you in every way.
All right, thank you, Amanda. Next, let's go to Steve Adams with Ogden Newspapers.
Yes, Steve Adams of Ogden Newspapers here. This is a question for Dr. Marsh. I see where WVU has reported that you will be returning more to your main day job and getting back into the things that you do at WVU Medical. I want to know, obviously, in that release, it says you're still going to be active with the task force and the state's planning for coronavirus going forward, but I wanted to know what exactly that entailed and what your involvement would continue to be in the future. Thank you.
Governor, good for me?
Sure.
Okay. Well, I appreciate the question, and I think that press release was really more of an internal sort of heads up that Dr. Jeff Coben had taken over some of the responsibilities in the health sciences, and given that the university is discussing how it may reopen and lots of details, that I've gotten pulled back and certainly am very committed to helping the university in any way I can. my alma mater and my day job, as you said. But as long as the governor and the team here on the press conference will have me, my plan is to offer no less commitment to this team. And as is true of many people, I have so many good people around me at the university, and there's so many good people here at the state that that my job is in many ways more of one that advises and sort of continues to watch some of the numbers and try to keep abreast of all the scientific new information that's coming out, which it comes out very rapidly. So I see this as less a change in focus and more just a more public internal recognition that I will be back in a more official capacity as the head of the Health Science Center, which is what I've done for the last 5 years. So my anticipation, unless the governor or President Gee tells me otherwise, that I'll continue in my present course and just add those responsibilities more officially back at the university.
All right, thank you, Steve. Next, we'll go to Mark Curtis with Next Star Media.
Good morning, everyone. Mark Curtis from 13 News, Next Star Media. I've got a question on how we're going to monitor all of this. A good chunk of the state economy is now open. Beyond the daily numbers from each individual health department, how are you going to monitor the situation? Because we may be in a case where we've got a lot of people coming into the state now, and a lot of people returning to businesses and restaurants, but we may not see a spike in the numbers for, 4 or 5 days. So how do you track it? And is there any way to close that gap, or is there a concern about having a big delay between the onset of maybe wave number 2 and us knowing about wave number 2?
Okay, I think, Dr. Marsh, maybe you can start, and then Dr. Slimp maybe can add to this, but please go ahead.
Okay, thanks, Governor. Well, Mark, that's a really important question. And I think that it really is 3 different sort of phases, 3 different interdependent areas. So number 1 is we will continue, as we have done, to look closely and now look at a county level for the activity that's going on. I think you're correct. Some of the cases, 50% of cases will be positive by 5 days. 97% of cases will be positive by 11 days. And as we look at, as we know, people can spread COVID in the half a day to 2.5 days before they are symptomatic. And so I think that continuing to test in these areas becomes important, particularly in areas that attract a lot of tourist activity with people who are coming in from out of state who may be in higher endemic areas of infection. The second thing we want to do is we want to continue to test our most vulnerable areas, and Commissioner Jividen has done a tremendous job in overseeing our response with the National Guard, certainly through the governor's insight and commitment to the state. And we want to recognize that when we look around the country, nursing homes, correction facilities, processing plants, places where people are very close together, and then vulnerable areas, including VA facilities, assisted living, rehab facilities, et cetera, are very high concerning areas, both because of the congregate sort of living conditions of people, but also because of the vulnerability of some of these populations. So I think we will continue to test in these populations. And as we see our activity change in a county, then we may actually change some of the surveillance methods that we use for people that work in these facilities, because as we know, people that are workers come back and forth, live in these communities. And so we want to keep an eye on that. And then the third area that we will do, as we've been doing, is start to identify those areas in our state that have more activity and start to do more focused testing, certainly through Dr. Slimp's office and the National Guard to come in and offer surveillance to our great county health officers and local health departments, and also start to think then about some other assets that we may be able to contribute, including masks and perhaps environmental assessments, so that we can reduce the potential that there may be any residual sources of these infections, particularly in high-risk areas, inside areas where people are stationary and sitting beside each other. So these are all things that we are doing and will continue to do. As the governor says, as we see fire, we will run to the fire, and we will continue to advise the governor so that he has all the information he needs to be able to make the right decisions, as he has done for the state of West Virginia.
If you come back to me just one second. Mark, I completely understand your question. I really appreciate Dr. Marsh's response. I mean, he's got a lot more information, from the medical expertise side than I have. But let me just say just this. It's my responsibility. Now, we want in West Virginia to embrace all. And we want in West Virginia to embrace others from out of state. But it is my responsibility to look after West Virginians. And that first and foremost. And that's what I'm going to do. And so the net of the whole thing is just this. We've told everybody over and over and over, that indoor dining, 50%, and wear a mask, indoor if you're going into a retail store or whatever like that. We've told everybody about social distancing and all that kind of stuff over and over and over. Mark, all we can do is watch our numbers. And as we watch our numbers and we have any level of West Virginian type outbreak in an area where the numbers start to rise, then we've got a problem there, don't we? And then what we do is we run to that fire and we address that issue and that problem and everything. That's what my job is. My job is to protect the West Virginians. And I'm going to do that first and foremost. I'm going to welcome all, and I hope and pray everybody, especially all those great Americans, or somehow can get through this safely. But my job is to protect the West Virginians. And that's what I'm going to do first and foremost. So the only way I know to do that, the only way is watching the numbers. And if we see a spike in numbers, whether it be in McDowell County or in Ohio County, well, no matter where it is, we're going to run, especially with the great, medical team and the medical experts, but our terrific National Guard, we're going to run and try to take care of it and everything. And then we may have to pull back or modify the activities that are going on in that area. And so that's the only way I know we can do it, and that's what we're going to do.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. I'd like to go back to that next round of stimulus that you were talking about, and I understand that enhanced broadband may be part of that. Is West Virginia in a position to take advantage of the new possibilities of work from home?
Well, I would surely hope and pray, because our broadband situation, from when I came in the door, it is just, to be perfectly honest, obsolete compared to a lot of other states and a lot of things. Now, we're making it better. We're making it better, and in order to be able to do so, you got to get a cooperation from lots and lots of different people, whether it be the carriers or the federal government or whatever it may be. And so you've got, a little bit of a balancing act to do all that, plus the money part of the whole thing. And so West Virginia, we're getting better, but if there were dollars to significantly increase that availability in that situation, it would really help us to be able to do a lot of great work from home and do it in a better way. But, I can't tell you exactly what is going to be in the additional stimulus package, but I can tell you that something will come, because there is too much push from both sides, in D.C., and when both sides are pushing against each other, you're going to have some level of compromise, and I do believe that there'll be another round of stimulus come in which West Virginia can glean off some additional dollars, and West Virginia businesses or individuals or whomever can benefit. Now, with all that, what will happen is just this, and this I know is going to happen, well, I think to the best of my abilities that this is going to happen, as they continue to ease back on the reins as far as the guidelines are concerned, we will be able for our counties and our cities to really, really take advantage of some significant more dollars. They're already doing it from the standpoint of our first responders, our fire, and police, medical, and all that kind of stuff. But they're already doing that, and there's already guideline releases that are helping our counties and our cities that they're going to be able to take advantage of right now. But with the additional stimulus that I think is coming, and with those guidelines being backed off, I really believe at the end of the day, from an economic standpoint, West Virginia is going to be in good shape.
All right, thank you, Paul. Next, we'll go to Kenny Bass with WCHS.
I have a question for Commissioner Jividen. What was the reasoning for waiting to do mass testing in our correctional facilities to wait to get a positive test? Was it a lack of tests or a lack of money for tests? And has the situation at Huttonsville changed anyone's mind in the administration about mass testing, especially in regional jails, which have far more turnover than our prisons do? And also that would include the correctional staff officers who are with their families and in our communities daily.
Thank you for that question. We have been following the CDC guidelines, and we have been following our policies as far as testing symptomatic inmates, medical screening when we came in. The first inmate who was identified as positive, in fact, was identified through this process. At that point, that's when we decided with the administration and in conjunction and coordination with our health department and DHHR and Bureau of Public Health partners that enhanced testing would benefit us in doing the contact tracing and getting a better feel for what preventative and reduction efforts we could take. So once that inmate was identified through our normal process, that's when we decided that now that we do have a positive, up until that point, we had been testing and we had no positives. Once we got the positive, the decision was made in conjunction with all of our partners and upon the advice of all of the experts that we needed to move ahead with mass testing. And that's the reason that we're doing it now. And that's the reason that we're trying to be as proactive as we can in addressing the challenge and combating the virus.
And Jordan, I want to jump in and say something about that too. Kenny, I think if we'd be really fair again, from all of our correctional situation and everything, and all of our inmate testing and all the testing that we've done, up until probably a week ago, and think about, we've been at this now from late February, all through March, all through April, up until a week ago, it would have been very, very difficult to say anything except what the job that Commissioner Jividen and the people have done and DMAPs and everything else. It really is terrific. We had 0 positives. Now, so then all of a sudden we do have a positive, and they follow the guidelines of the CDC and all this stuff. And what they do is they isolate a block where the prisoners have been, interacted with one another. They test everybody in the block. They test everybody, all the guards, anybody that has a touching of that block. And then, from that, then they come to me and they say, we're doing this and we're following these guidelines and everything else. And then on Fridays when I said, no. You go test everybody in the entire prison and go now. Now, that authorization came from me, and I think it came very, very quickly. And so now they're off, and they have tested everyone, and we'll find out from that. But that's exactly what's happened, and I really think it would be difficult to find a whole lot of fault with how fast they ran to the fire and everything. I think they've done a pretty good job.
All right, thank you, Kenny. Next, we'll go to Anthony Izaguirre with the AP.
Governor, why have you resisted debating your Republican primary challengers?
Well, it's not a matter of resisting. It's a matter of just this: let's just think about this just for a second. First of all, I have been in front of you every single day. I don't know how in the world that you could ask of me to expose any more level of transparency, because you have been able to ask me anything and everything every day. The second thing is just this. My opponent is running an ad right now that's a bald-faced lie. And we're entering a complaint today that is a criminal complaint, because we knowingly know that they're running an ad that's saying that I'm releasing prisoners and stuff that are criminals, that is the god-awfulest lie in the history of the world. The next thing is just this. All of the polling that we have done would show that my closest opponent is probably in excess of 40% away from me at this point in time. And the only thing that could happen from a debate is damage the Republican Party, damage us, in a situation where we're going to be running in a general election to win and keep the majority in the Republican Party. Now, from all that, with all the stuff that I am doing every day, why in the world would I be taking time away from what I'm trying to take care of here, considering all those facts, and run out and do something political? Like I said, I don't even know where my political office is downtown right now. All I am doing is trying to take care of West Virginians. So if that's not good enough, well, it's not good enough. But I think it's a waste of time.
All right, we have time for one more. We'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, last week you said Kanawha County was the only county that had applied for a portion of the CARES Act funding. Could you give us an update on that? How many counties have applied now, and about how much money has the state dispersed at this point?
I don't really have an update on how many of the counties that have applied. Charles, I can get you that, but I don't know that right now. We'll have to get you that. I'm sorry.
Yeah, Charles, we'll post that information later this afternoon. And Governor, I'll turn it back to you.
Okay, if I could just follow up just a second on Charles's question. Charles, I remind you this, that the restrictions, up until just a couple of days ago, the restrictions are so enormous that they're basically saying, you as a county, or you as a city, or you as a state, you can't really get dollars unless those dollars are directly related to COVID-19. And so therefore the restriction is so tight that it makes it really, really tough for counties to be able to, or cities to be able to submit today and derive real dollars. Now, I've said all along, I think those guidelines are going to really move and change and everything. And they have moved significantly the other day from the standpoint of our first responders or state police or those that were actively involved from the standpoint of backfilling those wages and everything else. And so we're telling people that and telling people, come on, you gotta apply and apply this way and all that kind of stuff. Now, I really believe on top of all that, you're going to see more and more and more come, and you may very well see it come in this next round of stimulus or whatever it may be, but you're going to see more come from the standpoint of being able to backfill lost revenue, because we in West Virginia, we don't want to backfill somebody's pension, that we didn't pay or whatever we got behind in paying and everything. That's not our situation. All we want to do is be able to backfill what has been lost because of this terrible pandemic. So right now, I can understand why there's not significant dollars out and everything, because the restrictions are so tight and everything thus far, but that's getting better. And really and truly, I've got one other thing to add, and it's just this, and it just goes back to talking to the people and talking in my lingo, or and this is how I would say to you just this. I've said this already before, but I don't know what the deaths are in the United States today, but probably a week ago they were running about 1,400 a day. Now I think we've dropped down to probably, we may even be at 1,000 or some number real close to that today and everything. But now just imagine if what happened last night was there was 4 airliners in this country, big airliners, and they all crashed. Well, we would absolutely that'd be the talk of the town. We'd be talking about it nonstop, and absolutely that would be all consuming. Well, that's happening. It's happening every day. And we're trying every way in the world to stop these deaths from this terrible killer. The thing that I would hope and pray that West Virginians won't do is get complacent. Absolutely just start going out without their mask, running around with, the elderly or whomever it may be, like nothing's wrong whatsoever, and all of a sudden, boom, it happens to you. Don't do that, West Virginia. Just think about the airliners just a second. If 4 of them went down last night, we'd be all consumed talking about that. That's what happened. That's what happened the day before and the day before. And the day before that, it was 5 or 6. 98,000 plus people now have died in the United States. That number will very, very soon go past 100,000. Way more people have died in the United States with this than that died in the entire Vietnam War, all 9/11 with it. This thing has really been terrible. Terrible in so many ways that I think our president's dead on the money about, from the standpoint that China could have stopped this. They didn't. And a bad actor, they were. Now, but we have to deal with it. And all I would ask you as West Virginians to do is what I've asked you so many times. Be smart. Absolutely take care of the old and listen to us about wearing this mask. I know it's an inconvenience. But it will really, really save a lot of lives. You've done great so far. Just please try to keep it up. Thank you.